So I have Mrs. Shields. She's a 50-year-old female on a 2-liter nasal cannula, and her vital signs are stable. She has a history of, she had a hysterectomy 2 days ago. Patient has a non-productive cough and developed a fever last night. MD ordered a Flutter valve TID. What I'm gonna do is I'm gonna wash my hands. I reviewed the patient's chart. Her contraindication would be that she had a hysterectomy 2 days ago, so we're going to want to watch her incision sites. And the indication is that she has a non-productive cough, so hopefully the Flutter valve will make her cough more productive. Okay, so I put my gloves on. I'm going to walk in the patient room. Hello, Mrs. Shields. My name is Taylor. I'm going to be your respiratory therapist today. Can you give me your name and birthday?
Taylor McBride, Mrs. Shields, October 2nd, 1999.
Okay, so I got my 2 patient identifiers. I'm just going to tell her that her doctor has ordered her a Flutter valve today just because she doesn't have a very effective cough, so, and she looks like she has some secretions. So we are going to show her how to use the Flutter and tell her that it's going to help get her secretions up. But before we do that, I'm going to place the pulse ox on her, and I'm going to use her stethoscope. And I'm gonna listen to her. Take a deep breath. Alright, I listened to her in 6 different places. She's starting at 98%. Her BPM's 95. Her respiratory rate is 21. So I got all her vitals done, and then I'm just gonna show her what the Flutter is. So I'm gonna say, okay, Mrs. Shields, this is the Flutter valve. What you're gonna do is you're gonna wanna make a tight seal around this part, and you're gonna wanna blow into it, okay? And there's a resistance on the back, so if you think it's too easy or too hard, we can always change it, but you're gonna wanna try to do this 10 times every hour. Usually we say just whenever you're watching TV and a commercial break comes on, do it a few times every time the commercials come on. So if you wanna go ahead and try it before I go, just so you can see. And does that seem too easy?
Seems a little easy.
Okay, we're just gonna turn up the resistance on it. Yeah, and just do it a couple more times, one more time. Okay, good job. So we showed Mrs. Shields how to use her Flutter. We explained to her how often she should do it, and she should feel, whenever you do it, you should feel a little flutter, and that's just all the secretions moving around, and hopefully they'll be coming up soon. So after you do that, I'm just gonna recheck the vitals. Great job. So her vitals look good. She's standing at the same, BPM 72, her respiratory rate is still 21. Her breath sounds still sound the same. I last listened in 6 different places. So I'm gonna ask her if she needs anything else before I go. Nope. Okay, so I'm gonna leave the room, take my gloves off, wash my hands. I'm gonna chart that I showed Mrs. Shields how to use the Flutter, told her how many times she should do it on the hour, let the MD know that she is able to do it on her own, and I'll come back in a couple hours to check and make sure that she's been doing it.